Almost 100,000 students didn't receive sufficient mental health support in 2015.
KOMU8's Maya McDonald is here in the studio with more on a University of Missouri study.
Researchers at the University of Missouri say the current way of mental health screening for elementary school students is not sufficient enough to have a good enough impact. They say there's more that can be done to create lasting effects for thousands of young Missourians. For many students in Missouri, school can be difficult when suffering from mental health issues. And according to a new study from the University of Missouri, more than 97,000 elementary school students could have used more help. Mental health screenings is where it starts.
We were looking at the accuracy of mental health screenings done for elementary students, and we used data that were collected from 3 different districts across 3 different states.
What researchers found was more could be done to identify specifically which students needed more support.
We're trying to identify young people who need additional supports, looking not only to the teachers who are terrific reporters, but also if there's a school counselor or administrator asking their parent or guardian, other adults who might be involved in their life, so a coach or someone out in the community.
Daniel Rector, who works alongside Maris, says better supporting at-risk students requires one thing in particular.
So whenever I think about how we can best support all students, what I really think should be a focus and an emphasis across the state, across the nation, is really systems of collaboration. What I think about whenever we're talking about supporting the whole child, it's not just what does the school do, what does the parents do, what do all these different siloed agencies do, but it's really about how do we come together as a structure, as an entire process, a system to support our kids.
Mars and Richter say one of the main issues for students and parents seeking mental health care services is access. The MU Bridge program hopes to alleviate that issue through their services.
So some of the problems with psychiatric access for children and adolescents is low number of child psychiatrists available, and then another issue is insurance and lack of insurance or underinsurance, and a third is just the parents' ability to navigate the mental health system.
With problems like these affecting many Missouri residents, Rector says community outreach like the MU Bridge program can make all the difference.
It's not a specific student, it's not a specific racial demographic or profile or anything along those lines. All of our kids are coming to us, and regardless of who you are, where you come from, you could have had something that's impacted you tomorrow.
The MU Bridge program provides psychiatric help to Boone County students in order to address some of the access issues many students and parents face. Live in the studio, Maya McDonald, KOMU8 News.